Welcome to the Weekly Dose Podcast, your one-stop shop for the weekly news in incretin mimetic therapies, with your host, ManOnMounjaro, Dave Knapp.
Welcome to this Tuesday, June 11th, 2024 edition of the Weekly Dose Podcast. I'm your host, Dave Knapp, ManOnMounjaro. That's why I'm here. You are on the pen. That's why you're here. Wegovy, Saxenda, Victoza, Trulicity, Mounjaro, Zepbound, that pen. That's what we talk about. We give you the news and all these medications that comes about throughout the week, as well as pipeline medications, investigational medications, and things that might change the lives of type 2 diabetics and people living with obesity like myself. We're going to get into the news right away this week because there's a bunch to cover. Hat tip Clark Kent, who puts together a lot of the news that we cover on this podcast every week. Thank you, Clark, for all the work that you do. But today, Patrick Johnson, one of the C-level executives for Eli Lilly, spoke at the 45th Annual Global Goldman Sachs Healthcare Conference, and we learned a little bit more about a molecule that we were introduced to during the last earnings call, and that molecule is called eloralintide. Now, eloralintide is Eli Lilly's amylin agonist. It's in phase 2 clinical trials, and you may remember amylin agonist from CagriSema. We talk about that molecule a lot on this channel because cagrilintide is going to be the next blockbuster weight loss medication, type 2 diabetes, incretin mimetic, to hit the market probably sometime in 2025, 2026. Around that time. And it's a game changer because it combines semaglutide, y'all know what semaglutide is, with cagrilintide, which is Novo Nordisk's amylin agonist. And where the weight loss ends with that is right around where what we've seen for retatrutide. Now, what we learned in this Eli Lilly earnings call about eloralintide is that they may release it as a standalone molecule, but they will be looking at testing it with other molecules, including retatrutide. Now, retatrutide, where you can get up to that almost for women, 28% weight loss with retatrutide, being able to couple that with an amylin agonist may be an absolute game changer, especially for those who are type 2 diabetic. Now, what we've learned in these clinical trials for these incretin mimetics and in real life, it tends to play out is that type 2 diabetics are much, much slower losers and lose much less weight overall when it comes to incretin mimetic therapies. It's just doing more metabolically than it is from a strictly weight loss standpoint. Now, what they have also learned in studying amylin agonism is that type 2 diabetics respond really well to amylin agonism when it comes to weight loss. And the thought being that because amylin is co-produced in the pancreas with insulin, that there is probably some level of dysfunction in the amylin production as well. And so it'll be very interesting to see this one come to fruition. They did mention another amylin agonist that potentially has a cortisol antagonist along with it. That'll be an interesting one to watch. But yeah, retatrutide being combined with an amylin therapy, that would be absolutely a game changer, as if retatrutide already isn't a game changer on its own. So that's what we learned as far as the news from Eli Lilly today during the Goldman Sachs 45th Annual Healthcare Conference. Of course, the good news keeps rolling in for tirzepatide in MASH studies. So this one comes from the EASL, the European Association for the Study of the Liver. Tirzepatide details of a phase 2 clinical trials were announced, and 44 to 62% saw resolution of MASH at 52 weeks, with 50% of the participants reducing their stage of fibrosis by at least one stage. Now, fibrosis of the liver is the stage before you get to cirrhosis, right? It's scarring, and that was once thought to be permanent. And what they're finding with these medications, tirzepatide and the newer generations that are coming along, like survodutide and retatrutide, which add the glucagon agonism, which maybe we'll see even better results here. But we're learning with tirzepatide that people are reversing fibrosis. Now, to compare this tirzepatide study to survodutide, which we've heard a lot about, that's going to be the investigational molecule from Boehringer Ingelheim in joint with Zealand Pharmaceuticals. That's in clinical trials right now. We actually had one of the clinical trial participants for survodutide on OnThePen, our weekly show on YouTube that happens every Thursday night, 9 p.m. And Scott, who is in the trial, shared a little bit about his journey with the survodutide trial. But that one really touts its MASH abilities to improve MASH. In that, you only saw 35% of participants reduce their stage of fibrosis by 1. And so you see tirzepatide as potentially being a superior molecule, even though survodutide adds that glucagon agonism, which seems to just, at least in the retatrutide trials, just melt off liver fat. So if you want to do a little bit deeper dive, I'll link in the description of the show notes, as we always do, put together again by Clark Kent. Hat tip for doing all that work for you. But if you want to dive a little bit deeper, just the news keeps on coming from tirzepatide, and it will keep coming. We learned a little bit in the Goldman Sachs call today, which just built on information that we've heard in previous earnings calls, that as these studies drop top-line data, whether it be MASH or cardiovascular outcomes or specifically with tirzepatide obstructive sleep apnea, you see all of these indications will allow backdoor access ultimately to folks on Medicare who do not have obesity coverage, who are looking to get on tirzepatide. So that's really, really, really positive news, and it's only going to get better from there. So the landscape of liver disease in this country are absolutely at an inflection point, and it will be fascinating to see how these GLP-1 medications can change that landscape. On the topic of survodutide, one of the interesting things that we learned this week is that Walgreens, yes, your local neighborhood Walgreens around the country, there are some locations that will be conducting clinical trials for survodutide, which we just talked about, the Boehringer Ingelheim Zealand Pharmaceutical joint. That's a glucagon GLP-1 receptor agonist. And that will have some testing done in their locations, perhaps coming to a Walgreens in your neighborhood. That is just an interesting thought. Perhaps this has happened before. I'm just not aware of it. I'm sure it has, but it's very interesting to see that these clinical trials are being extended out to pharmacies like Walgreens that can increase accessibility. Now, one of the interesting things on the topic of increased accessibility to these medications is you see these large companies starting to add telemedicine accessibility to GLP-1s. In this week's news, we learned that Kroger, by way of some of its local clinics that it has, I believe there's only a handful around the country, but at these clinics, they will be offering access to GLP-1 medications, just like we learned with Costco, adding that a few weeks back. So you'll see more and more of these sort of chain grocery stores with pharmacies and telemedicine adding the GLP-1 option to their customers. So everybody is going to be able to get access to care that could provide these medications. It's just going to become easier and easier as all these large outfits start to adopt GLP-1 access. So I think in the long term, that is a good play for everybody, increased accessibility via these, sort of walk-in clinics. Of course, with expanded access to GLP-1s, one of the large concerns among certain patient populations, again, this is not going to be for everybody, but among certain patient populations that are a little bit more vulnerable to the effects of loss of muscle mass, which comes with any amount of weight loss. And of course, GLP-1 weight loss is no different. Eli Lilly has acquired a couple of companies with some molecules that help preserve muscle mass. I think of Viatris and Bimagrumab. I believe it was Viatris was the company that they acquired that medication through, which was in clinical trials with semaglutide. Now that's their molecule. They're testing it with tirzepatide. A new phase 2 study has been launched with tirzepatide, and this molecule is mibavademimab. A mouthful, right? But this treatment is going to help preserve lean muscle mass during weight loss. And so one of the things that you see these companies that manufacture GLP-1s shifting to is not only, doses that are taken less frequently to achieve the same amount of weight loss, but ways to improve the quality of the weight that is lost by way of preserving muscle mass. And so Eli Lilly launched this next phase 2 clinical trial with bimavimab. I'm sure I'm butchering that, and I don't even care. You could just call it MDAB for short. But that'll be an interesting one to watch, and as will the trials that continue on with bimagrumab. This past week, Eli Lilly announced that their CFO, Anat Ashkenazi, will be stepping away from Eli Lilly and joining the parent company of Google, Alphabet, to help run their AI wing of their company. This is a fascinating transition. Anat Ashkenazi, just on a personal note, I've followed her pretty closely as I've followed Eli Lilly over the last couple of years. And of course, Anat Ashkenazi is right out at the forefront of all the breaking news with Lilly, because she's the one that is largely speaking at the earnings calls that take place every quarter typically at something like the Goldman Sachs Healthcare Conference as well, sharing the future of Lilly and just encouraging shareholders by way of the molecules they have in investigations and kind of keeping us up to date with that. So I followed her very closely. She seems to be a very compassionate woman. And it's always interesting because I feel like if I have one gifting, it's being able to be sort of a good judge of character. And I realize I don't have personal interactions with this person, but just in hearing her speak so often, it seems like she's got a real beating heart, which is rare in corporate America, it seems like. But to find a beating heart in corporate America, I can think of no better person to be sort of spearheading part of Google's AI department, somebody in corporate America that has the ability to see people and be compassionate and consider that angle of it. So that'll be an interesting transition. Some of the nuts and bolts are really interesting here. She's going to receive $9.9 million signing bonus to join on with Google, with a $1 million annual salary and $13.1 million in sign-on equity grant. She'll be eligible for an annual bonus of up to 200% of her annual salary, as well as new hire time-based equity and new hire performance-based equity. That is a haul. That is a haul. So congratulations to Anat Ashkenazi, who has parlayed the success that she has led Eli Lilly into this past, I believe she's been there for quite a long time. I don't want to guess, but I think that I saw maybe even over 20 years with Eli Lilly. Don't quote me on that, but parlayed a miraculous career with Eli Lilly that saw tremendous growth into this new position with Google. And of course, at OnThePen, we wish Anat Ashkenazi the best of luck in her new role. And we'll be sad to see her leave the incretin mimetic space, but excited for what she can bring to the AI space. And finally, for this week, one of the topics that we love to delve into is the flimsy patents on semaglutide. Now, semaglutide is notoriously under fire constantly, it seems like, for their patents. A lot of the patents around semaglutide having to do with the injector pens and things like that, which are all under fire and scrutiny in the United States. But in China, which has a totally different patent system, semaglutide is working to come off of patent in China in 2026, but basically there are 15 Chinese drug makers working on generic versions of semaglutide right now and fighting to bring them to market even earlier. So not only is Novo Nordisk sort of under fire in the United States and pressure on sort of their flimsy patents as it relates to the peptide, they're fighting these battles overseas. And of course, if they lose these, that's a great news for the generics market, right? And so many questions have popped up over the last couple of years around compounded medications, which essentially the 503Bs are just generic versions of that. Of course, true compound pharmacies typically happening at 503A level, where they're combining semaglutide with a B12 or something else, which is actually a true compound. But so many questions have arisen around this, and this could all be going away a lot sooner than we think if these patents don't hold up. So this will be a fascinating, the one to watch. And of course, we cover this often on the TikTok channel, especially. There's a whole playlist devoted to the patent saga with semaglutide. So a good reason to check that out. If you're not already subscribing over on YouTube, make sure you subscribe to YouTube channel. The video for this podcast releases before it releases to the rest of the world, to the members only. And then, of course, you can watch the video just a couple days later if you're subscribing. So I encourage you to find me on all the channels, whether you're on TikTok, Instagram, X, or YouTube. Make sure you follow me to stay in touch. And then definitely check out OnThePen.com. Sign up for email alerts. We will be bringing you the latest and greatest news right to your inbox. It's super easy. Sign up for email alerts. We'll link that in the description of the show notes. But until next week, thank you for being here. Thank you for being the best part of what we do here at On the Pen. Another hat tip to Clark Kent for helping out again this week, putting the news together. And also, one last thing, check out row.co/supply-tracker. We'll link it in the description, but Google Row Supply Tracker. They're doing a great job. We did an update with their CEO, Z Ritano, this past week on 30,000 submissions so far. And what we're learning is that the 5 milligram dose of Zepbound is the hardest to find, even though they brought that off of shortage this past week. So you did see that happen this week with the FDA updating the shortage list. It was just the 2.5 that was available in both Mounjaro and Zepbound. They updated that, saying allegedly that the 5 and the 12.5 will now be available. But according to the shortage reports on the website here, the 5 milligram dose of Zepbound is one of the hardest ones to find with, I think Z said, over 5,000 reports of shortage. So just a fascinating thing. Check that out. I would encourage you to use that. That tool gets better the more that we use it. And I just think that, the more that we can submit our shortage reports through there, it automatically submits that shortage report to the FDA and just requires the drug companies to be a little bit more transparent about what's really going on the ground. So I just wanted to give one last plug for that. Make sure you give the podcast a 5-star rating and review, and we will check you all next week. Have a great week. Thank you very much.